everyone, I'm Fola. Welcome to the 8th episode of the Diversifying Research podcast. This is a podcast where we amplify the voices of underrepresented individuals who are either involved in research themselves or engage other underrepresented groups in research. Over the course of this limited podcast series, we will critically consider how to improve the inclusion of underrepresented voices in research. During this episode, we're joined by Dr. Monjur Showkat, who is a clinical lecturer and researcher at Imperial College London. I'm going to speak to Monjur about cardiology and why he decided to get into that field, his engagement in the Pathways to Medicine program and Medic Dream, and his research into heart disease in the Bangladeshi community. Hello, Monjur. How are you?
Hello, Fola. I'm fine. Thank you. And thanks very much for inviting me on to the podcast.
You're welcome. It's a pleasure to have you on. So to start off with, can you tell us why you became interested in working in medicine?
Sure. I was born in Bangladesh, and since my childhood, it has always been my dream to study medicine. Throughout my time in school, I was intrigued by many British scientists and their innovations in science and technology. For instance, Sir James Chadwick's discovery of subatomic particle, that is the neutron, and James Watt's development and improvement to the steam engine. Obviously, there are a lot of other innovations by British doctors, scientists, but none more important to me personally than the advancement of first vaccine in the world by Edward Jenner, an English physician and a clinical scientist, and the innovation of penicillin, the first antibiotic by Sir Alexander Fleming.
Wow, it's great that you had so many people you looked up to as you were growing up, which made you want to pursue medicine. Can you tell us about the journey from being inspired by the British scientists you mentioned to actually working in medicine and research at Imperial?
It had been my dream to train in the UK as a doctor, and it finally came through when I received a scholarship from the World Health Organization to train and study cardiology in Imperial College London. During my first week in London, when I studied cardiology, I visited St. Mary's Hospital, which is part of Imperial College London, and then visited the building within the hospital where Sir Alexander Fleming himself discovered penicillin. That visit sparked a passion within me for research, as I had witnessed how research can make a positive change for the world, such as with penicillin. Over time, I have met a number of world-class clinicians, researchers, and academics at Imperial, and have taken the majority of my qualities from them.
That's really great to hear. It seems like you've had a lot of exposure over the years through your links to the World Health Organization and Imperial College. I'm mindful that some of our listeners might not know what cardiology is, so can you explain what it is?
Sure. Modern medicine is more advanced, and modern medicine is subspecialized, and modern medicine is more of evidence-based. So medicine has more branches. Doctors who works in cardiology, they actually deal with the patient with the study of heart and blood vessels. As a cardiologist, we need to understand what's going wrong with someone have got some problem or symptom with heart. For instance, sometimes when people have developed a heart attack, they develop kind of symptom, chest pain. It may radiate towards jaw or left arm. Sometimes when people have got problem with their heart valve, it could be leaky valve or it could be narrowed valve. Sometimes people have got a problem with heart muscles. As a cardiologist, we have to deal all these kind of problems.
Okay, that was a very clear explanation. Thank you. So I thought it would be good to invite you onto this podcast because despite being very busy working as a clinical lecturer, you still make time to engage in outreach programs to speak to young people about medicine, which is important when we're thinking about the theme of these podcasts, which is about how to diversify research, because your work helps to diversify the future intake of medical school students. Can you please speak about the programs you've been involved in?
Sure. Through my work in the Faculty of Medicine at Imperial College, I got involved in the Pathways to Medicine program, which is a 2-week program for young people from disadvantaged backgrounds between the ages of 16 to 18 years who are interested in studying medicine. It is a great program because it gives me the opportunity to explain to young people what life as a doctor is like and also how to get into the medical school. From my experience from Pathways to Medicine, I have co-founded a non-profitable company called Medic Dream with 2 other doctors, Dr. Amy Mallory and Dr. Montana Jackson. And we use technology to support students who would like to apply to medical school.
That's really impressive. Can you please elaborate on the role you have as part of the Pathways to Medicine program?
My role within the Pathways to Medicine program is all about supporting students to have better understanding of what being a doctor involves. On the program, I give students an opportunity to role play as a lifesaver in a simulated environment. So they have a fun experience of acting like a doctor for a day setting up that tries to mirror the real environment. For example, the young people have the chance to draw blood from fecums, give injection on fecums, which give them an insight into what they have to do on a real patient if they get through medical school.
So what do you think the impact of the program has been for the sixth form students you engage with as part of the Pathways to Medicine program?
I think there are 2 main impacts of the program on young people which I would like to highlight. Firstly, it gives the young people an overall idea of if the profession is suitable for them because they have an insight into what doctors do day to day. It is very beneficial because if during or after the program they realize that medicine is not right for them, then they have time to explore other subject areas which might be more in line with their interests. To get into the medical school, the program is to guide them through steps which are required to get into medical school, which is important especially for those whose students do not personally know any doctors, whether they can take some advice.
It's great that you're part of such an impactful program. And you touched on it earlier where you spoke about the fact you started a company with Dr. Mallory and Dr. Jackson called Medic Dream to support students interested in applying to medical school. Can you tell me about why you all started the company and how you've been engaging with students in the middle of the pandemic?
Oh, sure. We started a non-profitable company because we are passionate about providing support to students from disadvantaged background and ensuring they have representative role models they can relate to. Dr. Amy Mallory is a white British, Dr. Montana Jackson is Afro-Caribbean, and I'm Bangladeshi. It is important to have that diversity so we can inspire students from diverse backgrounds to believe becoming a doctor is achievable. The support we provide to students includes writing a personal statement, preparing for exams which are required to get into medical school, such as BMAT and UKCAT, and also if they are shortlisted for interviews, we support with that.
I'm glad that you've been able to carry on supporting students despite the pandemic. On top of your other activities, you're also a researcher and you've done a lot of work into heart disease within the Bangladeshi community. Why is that a research area you decided to focus on?
Internationally, cardiovascular disease is a major cause of deaths in Bangladesh. Also, Bangladeshis living here in the UK are twice as likely to die of heart attack or stroke compared to white British people. I was driven to do research in cardiology to find the reasons why Bangladeshi people have higher rate of cardiovascular disease. Is it their lifestyle or genetics or something else? My research covers cardiovascular disease and also in medical education. So in cardiology, I research coronary microvascular circulation, which is the tiny arteries that we cannot see by traditional coronary angiogram. A coronary angiogram is a procedure that uses X-ray images to see the heart's blood vessels, which allows us to see blockage in the major arteries. If someone develops symptoms of heart disease, it is difficult to diagnose. So I'm using echocardiography to know the answer about the microvascular problem. And echocardiography is a test which provides images of your heart using sound waves, and that allows doctors to monitor the heart. The research I'm doing, therefore, uses a contrast echo, which is a technique that provides an ultrasound scan of your heart. With contrast echocardiography to look at the microcirculation, I believe it could give some answer to the microvascular problem. Microvascular disease can be related to diabetes. People of Bangladeshi origin have a high prevalence of microvascular disease, which is what motivated me to do research in this area. I have set up a collaboration with a university called BSMMU, Bangladesh, where I'm looking into heart disease in women of Bangladeshi origin and women's cardiovascular system of difference to men.
Wow, that's really interesting, and it's very inspiring that you're actually engaging with institutions in Bangladesh and making sure that there's that collaboration, and also considering the gender differences as well. Are there other research areas you're interested in doing more work on in the future?
Thalassemia is a common disease in Bangladesh. It's a blood disorder which is biologically inherited and results in red blood cell being destroyed, can lead to anemia, which people feel tired and weak. There is a variety of thalassemia called thalassemia major that can affect heart because those who have got thalassemia major, they need regular blood transfusion. And what happens when people are on regular blood transfusion, and sometimes extra amount of hemoglobin or ion can lead into deposit into heart or other organs. And that's a condition called iron overload, or we call it iron heart disease. In Bangladesh, so far I know there is no iron heart clinic. With my colleagues from London, the Professor Shajal Banerjee from Bangladesh and his team in the BSMMU, we are about to set up the first iron heart clinic in Bangladesh. I hope once we start and provide this service, it will help Bangladeshi patients who has got iron overload because of thalassemia, and also will carry out our research. And I think probably this is such a thing we can make difference of people with thalassemia and make a difference in their life or help family members.
That sounds like a really interesting research area. So as you're aware, the government released a report on the impact of COVID-19 on different ethnic groups, which showed massive health inequalities, which is partly due to socioeconomic factors. But the report did mention how people from certain minority backgrounds, like the Bangladeshi community, have worse outcomes due to underlying health conditions such as cardiovascular disease. Do you think enough health research is being done into those from the Bangladeshi community in the UK?
I think more could be done, and I wonder if part of the problem is that there are not that many researchers from ethnic minority backgrounds. And I haven't met many other Bangladeshi researchers. The underrepresentation of Bangladeshi researchers probably affects the amount of work which is being done into understanding Bangladeshi health outcomes. Over the past 10 years, though, the number of people in clinical research from Bangladeshi origin has increased, and I hope that will lead into further research into health outcomes.
That's really interesting insight. Thank you. Aside from the research you do into the Bangladeshi community, as you mentioned earlier, medical education is one of your other research interests, as you're passionate about improving the experiences of students studying medicine. Could you please explain what medical education is and speak about the research you've undertaken?
Medical education involves the teaching medical students, which I am heavily involved in at Imperial College London, and trainee doctors in Northwest London. My focus is about helping students become safe doctors for the NHS and stressing patient safety when they qualify as a doctor. So my research is based on student engagement with learning and how technology could be used. When junior medical students in their clinical years placement, they need to do different procedures on patients, such as taking blood. But in their clinical placement, they do not always find patients to perform the procedures on. I have researched using WhatsApp to alert to other medical students using no patient details of areas within the hospital to perform clinical skills. Using WhatsApp as an alert system has been student-directed and has greatly improved student experience as they know when to go to the ward. For example, they might be studying in the library and then they get a message saying there is a ward where a learning experience is taking place, they can join. I've also researched students' communication with senior colleagues, such as handovers. I help to develop a software to engage students in handover, which will help them prepare for when they become doctors. I'm also researching blended learning and technology-enhanced learning to help students understand how to manage cardiac emergencies in real life.
Those sound like really important research areas, and I'm glad that you've been able to improve the learning experiences of students in very tangible ways through research. I guess another aspect of medical education is also about the students developing soft skills such as empathizing with and understanding local communities. So have you done any work around actually getting medical students to engage with local communities?
Yes, from my experience with Pathways to Medicine, I have encouraged medical students from different medical schools in the country. For instance, students from Imperial, University College London, St. George's Medical School, University of Brighton Medical School, University of Cambridge, to also take part in the Pathways of Medical School program. Through being part of the program, they have been able to understand different communities and culture, and understand how to adapt the way they communicate to different audiences. Also, I have gotten the students to appear on the community-based TV channels based in the UK, but catered to Bangladeshi community, so they are exposed to different cultures.
Wow, that sounds really interesting. I'm sure the students gained a lot from those experiences. So some of our listeners might be interested in getting into medicine or research, some of whom might be from underrepresented backgrounds. So for instance, some might be Bangladeshi like yourself. What is some advice you can give to them about getting into the field?
No doubt there is a less representation of Bangladeshi doctors, and I'm clear about the underlying reasons. But I think if someone is keen and enthusiastic, then they should try their best to pursue their dreams. The innovation has to come from you because it is a challenging journey which requires you to prove your skills and potentials. I will encourage people to represent themselves and communities which are not represented in this space. The impact of getting more underrepresented people involved in the research is to contribute to research internationally, support the National Health Service, and improve healthcare innovation in the UK. At first, when I got into research some years ago, I didn't always get responses, but I had determination, which is important for all researchers. Once you achieve your dreams, it can be very rewarding. Imperial College is a very diverse institute, and there are great opportunities for me to work in such a big institute, and there are a lot of people who have helped me during my journey as a researcher.
That's really inspiring to hear. Thank you for your nugget of wisdom. Being persistent is definitely an important quality to have. We have now come to the end of the podcast episode. Thank you very much for joining me on this episode, Monjur. I appreciate learning about the exceptional work that you've been involved in to engage young people from disadvantaged backgrounds in medicine and your research into heart disease in the Bangladeshi community. For those listening, please make sure you tune in to our next podcast episode where Maria Pigeon, who works in the Patient Experience Research Centre at Imperial College London, will be speaking about the support that's available to researchers to help them to involve the public in their research. Thank you.